Good evening, everyone, and welcome to our program tonight. Our program is Your Ship Has Come In, Learn About Medicare. We have tonight as our presenter, Cathy Forbes. Cathy, welcome, and thank you for doing this for us. Cathy has been the county coordinator for SHIP in Mercer County since 2016. SHIP is a free and impartial counseling program for people with Medicare and funded in part by the Administration on Community Living. SHIP services are always free of charge, confidential, and impartial. And with that, I will turn it over to Cathy so we can learn all the complicated things there are to learn about Medicare. Thank you, Cathy.
Hey, hello, welcome to everyone. Thanks for joining us on well, hopefully it was a slightly warmer day today in February, but in the evening. What I'm going to do is I'm going to share my screen so you can see the presentation. For anyone who does want a copy of the slides afterwards, the library does have a copy, or you can reach out to me directly. Again, if you have any questions or you want more individualized advice, again, I'm very happy to help. If you have questions through the presentation, you can use the chat box, and Tara will either stop me or she will put the questions to me at the end. And so what I'm going to do is share that screen with you. It is also being recorded, the presentation, so you'll be able to get it after as well. So just bear with me and we'll get the sharing started. Hopefully. There we go. So as Tara said, I am the coordinator here in Mercer County. SHIP is a nationwide program, but the different programs in different states do have different names. So here in New Jersey, we're SHIP, like our national program is. But if you were to go over the border into Pennsylvania, it's called a prize. Up in New York, it's high cap. Down in Florida, it's quite appropriately called Shine. And I say to people every time I do a presentation that my personal favorite is Ohio, where they call it OSHIP, because that's really what people think when they're going on to Medicare. The reason it's split down into county level is just so you know you're speaking to somebody locally who understands what things are like in your area. But if you're from outside of Mercer County and you want to speak to me, I'm always happy to try and help. But my colleagues across the state are excellent. And we do have a network of volunteers that help. But if you want to reach me, you can call or text. If you don't want to speak to me, you're welcome to text or email. We do also have a Facebook page as well, where you can keep an eye on what is going on both locally and nationally. So as I said, the programs are here. Everything is always free. It's going to be objective. We're not selling you anything. Nobody who works with SHIP works for an insurance company in any way. And we can also go through things in depth. Obviously, tonight, I'm going to keep it, it's going to feel like a lot of information, so I don't expect you to come away knowing everything. But it's not going to be as in-depth as if you had an individual consultation with one of our SHIP counsellors. Because everything is individual to you and your situation. Now, I've mentioned our SHIP counsellors. They are certified following training delivered by the state of New Jersey SHIP team. And that training runs over 6 days usually. We have 2 update meetings a year, and also, particularly this year, some online training in between. So it does show that there's a lot to know about Medicare, and we don't expect any one person to understand all of it. It's about understanding what questions to ask so that you get what's right for you. So just taking it right back to the beginning about eligibility for Medicare. Well, you become eligible for Medicare in 2 ways. Either you turn 65, or if you've been receiving Social Security disability payments covering a 24-month period. So if you are approved for Social Security disability and you receive a back payment covering 12 months, then you would only wait a further 12 months before you became eligible for Medicare. So that does mean that people of all ages, 18 and up, can be on Medicare, but most people would be over 65. Now, if you are collecting Social Security benefits at the time when you become eligible, then you will be automatically enrolled into Parts A and B of Medicare. So when everyone, or the majority of people were eligible for their full benefits at 65, this worked quite nicely. People would collect their benefits, they'd go on to Social Security. But the world has changed and Medicare is still catching up. So that means that if you are not going to be collecting your Social Security benefits until 66 or older, but you want your Medicare to start at 65, you're going to have to take action. Vice versa, if you're working beyond the age of 65 and have healthcare coverage through a large employer, then you may not want Medicare at 65, even if you're collecting Social Security payments, and therefore you need to know when you enroll. So when you're looking at it, as I said, automatically you will get enrolled if you're collecting your benefits either when you turn 65 or you've had your 2 years of Social Security disability. You can opt out if you don't want to be enrolled because you have other coverage. That coverage must be creditable coverage. I'm going to go through on the next slide what that actually looks like, because not all coverage would be creditable. Now, if you are turning 65, but you're not collecting your Social Security benefits at 65, but you want your Medicare to start then, you have what's called an initial enrollment period. That starts 3 months before the month of your 65th birthday, or if your birthday is on the 1st of the month, it would be the month before you turn 65. But basically 3 months before the month of your birthday, the month of your 65th birthday, and 3 months after, in which you can enroll in Medicare Parts A and B. And you're not going to be late, no penalty. So if, for example, you are out of work and you're thinking, I'd like to wait, see what happens, see if maybe I get another job, I maybe won't enroll in Parts A and B, you only have 3 months after the month of your 65th birthday to enroll. Now, if you do enroll in those months after the month of your 65th birthday, your Part B start date will be delayed. And it's delayed by the number of months after your month, after the month. So sounds confusing, but basically, if you wait, you say you were 65 in January, but you wait until February to enroll, your coverage will be delayed 2 months. If you wait 2 months, it'll be delayed 4 months. If you wait 3 months, it'll be delayed, I think it's 6 months. It's certainly longer than 3 months. So there is a delay before it starts. So yeah, 6 months after your 65th birthday. So you wait a further 3 months. Now, if you've missed all of it and you're sitting there thinking, I missed the dates, I don't have any other coverage, what do I do? You are ideally right now in what's called the general enrollment period. So between January 1st and March 31st every year, you can get in touch with Social Security and say, I'm sorry, I'm not enrolled in my Medicare. I would like to get enrolled now. Your coverage for Part B will then be effective as of July that year. Unfortunately, if you realize that you want coverage and you waited until April 1st to realize that, you are going to have to wait until January 1st of the following year, and your coverage won't begin until July 1st. This is why it's always important to know when your enrollment periods are. There is a premium penalty if you don't enroll in Part B and you don't have creditable coverage. That penalty is 10% of the Part B premium for each full 12-month period that you're eligible but not enrolled. And you do have to pay it for as long as you end up having Part B of Medicare. So you might be thinking, okay, well, I don't want coverage to start because I have creditable coverage elsewhere. So what do I do? How do I get coverage when I need it? Well, you're going to be eligible for what's called the special enrollment period. Now that occurs where if you have delayed your Part B enrollment until after the age of 65, because either you or your spouse were working for a large employer and you had an employer health plan as primary, then you get an 8-month period starting from when your healthcare coverage ends, in which to enroll in Part B without penalty. Now, obviously, if you wait till the end of the 8 months then your Part B won't start for 8 months. If you didn't know your coverage was ending, then actually that 8 months, I believe, begins from the date that you're informed that it ends or that it has ended. I'm going to talk about what creditable coverage is, but I do want to make sure that you know you do get that special enrollment period, because some people will say, will try, they're not trying to panic you, but they will try to tell you that you must enroll around your 65th birthday. You can delay it within certain reasons. Now, the reason that I'm talking particularly about Part B of Medicare is because Part B has a premium. Part A of Medicare for most people is premium free. So there is not a penalty for late enrollment, and you can enroll in Part A of Medicare at any point after you turn 65. Now, if you enroll in Part A of Medicare after you turn 65, your Part A enrollment date will be backdated up to 6 months. So if you turn 65 in January, but you don't enroll in Part A until June, your Part A date will be backdated, so it would have started on January 1st. The reason why that can be important is if you are contributing to a tax-free health savings account, that's an HSA, not an FSA, but an HSA. If you are contributing to an HSA, you do need to make sure that you don't contribute to it at the same point where you would have Part A of Medicare. So you need to stop contributing, I would say at least 6 months before you intend to have your Part A start. So that is something to bear in mind if you have an HSA that you will be contributing to beyond the age of 65. And if anyone has a concern, you can welcome to speak to me, but I would actually suggest talking to Social Security to make sure that you get the dates correct. So I've talked a lot about Parts A and B of Medicare, but Medicare really it's suggested that it has 4 parts. So Part A is your hospital insurance and Part B is your medical insurance. So that is anything you would get outside a hospital or anything that has an office outside of hospital. So it's a lot of pretty much all doctors, things you get as outpatients, ambulance service, lab work, x-rays, therapists. They all come under Part B of Medicare. Now, when Medicare started, that was all there was to it, Part A and Part B, and together they're known as Original Medicare. Those are the only 2 that you will see on your actual Medicare card. Part C of Medicare was added later. It was added as an idea, as a different way for people to organize their Medicare, and was known as Medicare Choice, which is why it has ended up as Part C. We don't call it either Medicare Choice or Part C anymore. We know it now as a Medicare Advantage plan. When Medicare Advantage was conceived as an idea, there was no drug coverage as standard as part of Medicare. It now is, and generally a Medicare Advantage plan will cover your hospital coverage, your doctors, and your drug coverage. It's all wrapped up in one bundle. And instead of Medicare being your primary, Medicare has effectively passed the risk for you onto an insurance company. The insurance company will receive a payment for each beneficiary that's enrolled with them. And it is then their responsibility to ensure that you get care which is at least as good as what you would have got under Medicare. It's why Medicare Advantage plans can offer additional coverage, but all claims will be processed by the plan rather than by Medicare. So you are still enrolled in Medicare, but instead of Medicare being billed, it is your Medicare Advantage plan. Now, I'm going to go through it again, so I'm going to repeat a lot of what I say again. That's just because it is complex. Now, Part D of Medicare is your drug plans. This wasn't added until 2006, at which point it became mandatory to have drug coverage that was at least as good as a Medicare drug plan. Now, each part of Medicare has its own premium rules, it has its own deductibles, it has its own cost sharing rules, and it has its own rules for enrollment. So like I said, it is complicated. However, it's about breaking it down to understand what you need to do piece by piece. This is for those people who are a little bit more visual. So again, part A is your hospital stay. It's your inpatient hospital stay. It's skilled nursing care, or we would probably call it rehab, hospice care, and also some home care. Part B for boy, that is your doctors, it's surgeries, it's lab tests, medical equipment, preventive exams, basically anything like I say that you would get outside of hospital. Now, the reason why A and B say partial coverage is because although you've paid in your Medicare taxes and you're paying a premium for your Part B, you still have co-insurance or co-pays that you need to pay for your Medicare services if all you have is your red, white, and blue Medicare card. Now, Part C of Medicare, that is, like I said, your Medicare Advantage plans. But the idea is that the costs are more predictable. And like I said, the companies that offer Medicare Advantage plans can choose to add additional coverage. So it can include things such as eyeglasses, money towards hearing aids, and it will cover some vision, dental, and hearing. Now, Part D of Medicare, like the Medicare Advantage plan, is offered by private insurers or health plans. Now, it will help with the cost of prescription drugs. It says not covered by original Medicare. There are certain drugs that come under Part B of Medicare. These are drugs which are infused. So, for example, chemotherapy medication that is infused in hospital would be covered under Part B of Medicare. And in fact, Prolia, which an injection that women can have for osteoporosis, that can either be covered by Part B if it is ordered and administered by the doctor, or under Part D if you order it from the drug plan. And depending on how you get it will depend on how much you're paying for it. So it is important to know that some drugs will be covered under your Part B of Medicare, because that affects how much you will be paying towards it. So Part A of Medicare, the costs, what are you paying? Well, as long as you contributed to your Medicare taxes for at least 10 years or 40 quarters, or you're married to someone who did, then there is no monthly premium for Part A of Medicare. There's no late enrollment penalty. If you don't have a premium, there's no late enrollment penalty. But the big cost comes if you are admitted to hospital. If you are in hospital and you are in hospital as an inpatient, then the deductible in 2021 is $1,484. Now, it is what is considered a benefit deductible, which means that if you are discharged home, but you are readmitted, whether it's for the same problem or a different problem, but you are readmitted within 60 days, you don't pay the deductible again. However, if you are discharged from hospital and you're out for 60 days or more, and you are readmitted, even if it's through a recurrence of the same issue, then you have to pay that deductible again. $1,484 is not a lot, it's not a small sum. So the reason I emphasize it is because it helps to explain why some of the other insurance costs are so high, because that is a lot of money that you have to pay up front. Now, if you're in hospital for the next 60 days, your bed and board is covered. So that's good news. After that, then there are daily co-pays as well. Now, the inpatient rehab stays, or that skilled nursing care, is only covered if you have a qualifying hospital stay first. Now, a qualifying hospital stay means that you have been an inpatient in a hospital for 3 night times. They sometimes known as the 3 midnight rule. So if you are in hospital, but you're under observation status, you're there as an outpatient, then you wouldn't qualify for the rehab stays. Now, during the COVID-19 pandemic and not wanting to have people hanging around in hospital for longer than they needed to be, the requirement has been waived, but I just want to draw notice to it, because you don't want to have someone go to a skilled rehab facility thinking they'll be covered under Medicare, only to find that it's not going to be covered because they didn't go into hospital as an inpatient first. Now, your first 20 days in an inpatient rehab is covered. Then there are co-pays up to day 100. I'll be honest, I'd have to double check that, but the benefit does expire unless you're readmitted to hospital and you qualify again. You can qualify as many times as you need to, as long as you're having those inpatient stays in between. Now, Part B of Medicare, Part B of Medicare does have a premium. 2021, that premium went up to $148.50. So that was nearly a $4 increase on 2020. When I first started doing this 5 years ago, the monthly premium was $104 per month. So it has shot up really quite quickly. The reason for that is that Medicare has to balance the books. So as the cost of healthcare increases, and also as the as the number of older people increases, the pressure is increasing on Medicare, and so the premium has gone up. Now, if your income on your tax return puts you into what's considered a high earner bracket, which means more than $88,000 if you're single, or $176,000 if you file jointly, then you will have a premium uplift. It's known as IRMA. Now, a lot of people may earn over that amount when they're working, but when they retire and are going on to Medicare, their income drops considerably. And it is it's the adjusted gross income line on your income tax. So if your income in the year where you are starting on Medicare is going to be lower than 2 years previously, you can fill out a form, and it's called SSA 44, to appeal the higher premium. It is definitely worth doing. It can happen. You don't have to have stopped working. It could be that you either changed your job at some point, that you lost a spouse, something that's a qualifying life-changing event. You can appeal that premium and ask for it to be for your premium amount to be assessed on your income now, rather than on 2 years ago. Because if you think about it, your tax return is from 2 years ago. Because the Social Security and Medicare are looking back 2 years, you may have to fill out form SSA 44 twice, so that it covers each of the years until everything gets caught up again. Now, if you're on the other end of the scale and your income is limited, there are programs to help with Medicare costs. There is specifically programs to help with Part B premiums. And if your income, as you can see, is less than $17,466 if you're single, or $23,514 if you're married, and in this case, it doesn't matter whether you file jointly or singly, you will be assessed as a married couple, and your assets are limited, then it's less than about $7,800, excluding a house and a car, then you may be eligible for a program that will pay your Part B premium. Anyone who knows someone who might be in that situation, or if you yourself are, please get in touch with me, and I can easily do that application for you over the phone as well. Now, the Part B deductible in 2021 is not as eye-watering as the Part A deductible. It's $203. Last year it was $5 lower, so that is not going up as quickly. But it's $203. After you've met that, it's an annual deductible. So after you have met that, then Medicare will pay 80% of the Medicare approved rate for covered services. That's the 80-20 split that most people remember, but it is only for Part B and once you've met your deductible. Now, that deductible is annual. It's based on a calendar year. So if you start on Medicare in December and you've just met your deductible, it starts all over again in January. Now, when I talk about the approved rate, that is because Medicare assigns a payment rate or payment schedule for everything. It is national. And if a provider agrees to accept the Medicare assignment, then they cannot charge any more than the Medicare approved rate. If a provider accepts Medicare but not Medicare assignment, they cannot charge you more than 15% over the approved rate. That is more there to protect you. We don't often see it happening in New Jersey. The only times I've really seen it is where a doctor who didn't normally see Medicare patients agreed to see somebody, and they were actually trying to overcharge. In both cases, they tried to overcharge the beneficiary, and we were able to use that, the agreement cannot be more than 15% more, to prevent them from overcharging. The other place you might see it is with mental health providers, and I've only heard about that anecdotally, so I don't know how frequent it is, but it's probably because mental health is less well understood than physical health, so those approved rates may not be set quite right. So I talked about whether you might want to delay Part B enrollment. The reason you might want to delay it is because you don't want to be paying $148.50 every month if you don't need to. So when can you delay it? Well, you can defer it once you become eligible for Medicare. If you are still working and you're covered by group health benefits from a large employer, or your spouse is working for a large employer and they are covering you with their group health benefits. Now, a large employer in this situation is defined as 20 or more employees if you're on Medicare due to age, so you're over 65, or 100 or more employees if you're on Medicare due to disability. Now, it does have to be a group health plan, so it can't be if the company is giving you money to buy your coverage yourself, then that wouldn't count. And if you work for a small employer, but they buy their health plan as a consortium with other small companies, then it may make it a large employer. Social Security can confirm that for you. Now, that's fairly easy. You know if you're working, you can check with your HR if it's a large employer, or you know if your spouse is covering you. What's really important to know is when you would get a late enrollment penalty if you didn't enroll. And one of those that's come up a lot this year is COBRA. So even if you've been offered 12 months of COBRA, remember you need to enroll in Part B of Medicare within 8 months of finishing work if you're over 65. So you can wait the 8 months if you're getting a good COBRA deal, but don't wait beyond that, or you will have missed your special enrollment period. Similarly, small employer, or if it's not group health coverage, you wouldn't be covered. That's not creditable coverage. If you have only got retiree coverage, because it needs to be based on you actively working or your spouse actively working, marketplace coverage is not creditable. If you have marketplace coverage and you become eligible for Medicare, you will lose all the tax benefits that make the marketplace coverage affordable. The governing people, I'm not sure if it's the state or federally, but they are trying to improve the communications to people who have marketplace coverage, because it wasn't very clearly stated. And if you have no other healthcare coverage, you need to get enrolled into Medicare. So Part C and D in Medicare are both considered optional. So Part C, Medicare Advantage, usually includes drug coverage. Part D is your drug coverage. Now, because both usually have drug coverage, you can't, on the whole, have both an Advantage plan and a drug plan. There is an exception to that, and that would be the New Jersey State Health Benefits Plan, where you have a Medicare Advantage plan and a separate Part D drug plan. However, if you're purchasing, if you thought you wanted a Medicare Advantage plan, then by enrolling in that, you would lose your Part D drug plan, and vice versa. Now, although the drug coverage is optional, it's mandatory to have some sort of drug coverage. So you are required to have drug coverage that is at least as good as a Medicare Part D prescription drug plan. So that would be, for example, an employer, union, or retiree coverage. And your insurance company will be able to confirm if the coverage is considered creditable. They can, some send out a letter every year to tell you, sometimes you have to request it. If you have drug coverage as part of your Medicare Advantage plan, that is creditable. Like I said, you don't need both a drug plan and a Medicare Advantage. But if you are using a prescription discount card like GoodRx, or you're involved in a drug manufacturer's program, or you have a pharmacy or supermarket program like Sam's Club or Walmart that you're in, that is not as good as Medicare Part D drug plan. That is not creditable drug coverage. If you do not enroll in drug coverage within 2 months of there is a delay about when you can enroll initially, but basically the rule of thumb is don't go more than 2 months without drug coverage once you're on Medicare. Otherwise, you will be liable for a penalty when you do enroll, and that is calculated on a monthly basis as a percentage of the average premium for the year for the nation. And that penalty will follow you through for the rest of your Medicare career. If you're over 65, if you're under 65, you'll have that penalty until 65, at which point it will be wiped clean. But with that, you also will have to wait until you have a special enrollment period or until the annual enrollment period to be able to enroll in a drug plan. So it's basically not worth it to avoid having drug coverage, even if you don't take any medications, because you're going to get a penalty. And that penalty, if you were to leave it a year, the penalty works out as about $4 per month additional if you go 12 months without drug coverage, and it obviously increases, and you'd be paying that on top of any premium afterwards. So I'm just going to go through your Medicare coverage choices. So you have 2 ways of looking at it. You can either go with original Medicare, which means Medicare is your primary. You can go to any provider or hospital in any of the 50 states and the 4 protectorates of the US that accepts Medicare. You can choose to add prescription drug coverage from Medicare unless you have drug coverage from elsewhere. And you can also add supplemental insurance, which will be either a Medigap policy, or if you have a retiree group health plan that is structured as a supplemental plan. The alternative is to go for a Medicare Advantage plan, or this Medicare Choice. It means that everything is rolled in. Your Part A, your Part B, your Part D is all in one card. That's the only card you need to show. And you will be paying less on a monthly basis in terms of a premium for this plan, but there will be a network that you do need to stay within. And also you pay as you use services. So it's 2 slightly different ways of organizing it. So if we think about original Medicare, you can add a Medigap plan that pays after Medicare pays. The coverage is standardized by Medicare, and there are 10 plans labeled A through N. Now, I say 10 plans, but 2 of those, plans C and F, were grandfathered, so they are no longer available for people who became eligible for Medicare after January 1st, 2020. If you have Part A of Medicare prior to January 1st, 2020, you can still enroll in a Plan C or F if you want to. Now, all the policies offered under a lettered plan must offer the same coverage. Just paying a higher premium can't get you any additional coverage. The only variation is the premium cost. Now, the premiums will be based on how much is being paid out in claims. The insurance companies have to have any premium increases approved by the Department of Banking and Insurance, the state in which they're being sold. And the amount that's being paid out in claims is really going to reflect the health of the population that's enrolled in that plan. However, you may look at companies and go, I know that company well, I feel comfortable with them as an insurer that they will be able to underwrite and meet their financial obligations, and that you may be willing to pay more for a plan from that company. However, when you go to a provider, they cannot turn you down based on your Medigap plan. If they accept Medicare, then they accept your Medigap. Medigap is basically a bill paying function, so that you go to the doctor, the doctor bills Medicare pays their portion, and then it goes on to the Medigap plan to pay their portion, and there may or may not be anything left for you. Now, the premiums are relatively steep. They are $100 to $350 per month, generally, depending on the plan letter, your age, and your gender. The older you are, the higher the premiums. If you're a male, unfortunately, you're also going to be paying a higher premium just because your health needs are more likely to be higher. Now, some companies do offer household discounts. So if you're married, this is a good time. See if you both get it from the same company, you may be able to get a discount. But remember that the premiums don't relate to your own claim history. So it's the population. So you're going to be paying the same whether you go to the doctor once in the year or whether you are in and out of hospital, and you're paying that, or the Medigap is paying that $1,484 deductible for you on a regular basis. As long as you pay your premiums, you can't lose your Medigap regardless of your health status. So it's always important to pay your premiums. But there are conditions on when you can buy your Medigap plan. I'm going to see if it's on my next slide, but just to reiterate, with a Medigap, you can go to any doctor, provider, or hospital that accepts Medicare, because these are national plans. They will cover some or all of your deductibles, copays, and co-insurance. So you're paying more, you're paying upfront. Like I said, it's not related to how much you use. A lot of what you're buying is peace of mind and flexibility. And if you move states, you can take the plan with you to your new state. However, the plan will only cover what Medicare covers. So if it's a service that's not covered by Medicare, the Medigap won't pay. And if the service is denied by Medicare, then the Medigap also won't pay. Okay, so I don't have a slide about the when you can enroll, so I'll just talk that through. So with a Medigap plan, when you first become eligible for Part B of Medicare, you have a 6-month period in which you cannot be turned down for a Medigap plan, regardless of your health history. So there will be no medical underwriting. The plans may ask medical underwriting questions, but they cannot make their decision based on your answers, and they cannot charge you more based on your health history. They must offer you the preferred rate. After you've been enrolled in Part B of Medicare for 6 months, there are only specific circumstances where you will have that guaranteed issue right again in which to buy a Medigap plan. They are all listed on the Medicare.gov website, and they're also in your Medicare Renew handbook. And I'd be happy to go through it if you think that this might relate to you specifically. The reason why I mention that is because if you then look to buy a Medigap later, if you think, well, I don't want to pay $100+ per month for something when I only go to the doctor once a year, that's fine. You can think about making that saving. But if you wait until you need healthcare, then you're going to have to go through that medical underwriting, and you may be turned down or you may be charged more for a plan. And generally, because age is considered kind of a health history issue, if you wait until you're 80 and you don't have a guaranteed issue, you may find it very hard to get a plan written at any real price. So it's just something to bear in mind. So if you have original Medicare, what you'll see on your card is your A and B. Obviously, you're paying a premium for your Part B, and you may also have a Part D prescription drug plan card, and you may or may not have a Medigap plan card as well. If you don't have a Medigap card, and you don't have supplemental coverage from an employer, then just remember that if you go to hospital, you would have that $1,484 deductible. And if you go to the doctor, once you've met your Part B premium, then you would be paying up to, 20% of the cost of your care, and there's no maximum out of pocket. Medicare Advantage plans, you're still going to have your Medicare card with Parts A and B on it. Still have to pay your Part B premium. Only people who have Parts A and B of Medicare can enroll in a Medicare Advantage plan. But when you get your medical services, you're going to show your Advantage plan card to the provider. And the Medicare Advantage plan will set their own cost-sharing rules for those services that you get under Parts A and B. What happens is that Medicare pays about $800 or $900 per month for each beneficiary in New Jersey that is enrolled with a Medicare Advantage plan company. That's why as you start coming up to your 65th birthday, you will receive a deluge of mailings. You'll get some from the Medigap companies who would like you, young and healthy, to be paying your $100+ per month to them, hoping that you never go to the doctor or get admitted to hospital. And the Advantage plan companies feel exactly the same way. They would like you to be enrolled, but they're going to receive their money direct from Medicare. And they're going to hope that if they can keep you healthy, that you won't need to go to the doctor, you won't need more expensive treatments that they might have to dip in for. So for that reason, with the Advantage plans, a lot of the care that is to keep you well, particularly going to see your primary care doctor, will be low cost, because they don't want to put barriers in to what would keep you healthy. Now, if you're healthy, you can really take advantage of that. That's fantastic news, but you will pay more as you go, as you use services. So for example, if you're admitted to hospital, then you, with an Advantage plan, you're usually paying $300 to $400 per day for the first 5 or 6 days. That means if you're in hospital for a week, you're basically paying the equivalent of a Part A deductible. However, unlike the Part A deductible, if you're discharged and readmitted, you start paying those daily hospital co-pays again, even if you were only out of hospital for a short time. If, for example, you take an ambulance trip and you have a Medicare Advantage plan, that will cost about $250 for an ambulance trip. Surgeries, usually between $100 to $300. To see your primary can be between $0 and I think about $25, and to see a specialist will usually between about $5 and $50 for a specialist. Now, there is a maximum medical out-of-pocket for Medicare Advantage plans. That should say in 2021 is the maximum that you can be asked to pay for medical, not drug coverage, that's always separate, is $7,550 for in-network care. Once you've hit that, then the rest of your medical care, in that case in network, would be covered in full. The people, and I have come across people where they've reached that, those people, it's generally if you're getting cancer treatment. The reason for that is that generally chemotherapy medications, you pay 20% of the cost of the chemotherapy medication if you have a Medicare Advantage plan card, a Medicare Advantage plan, and therefore you can quite quickly get up to $7,500. Now, when can you review your coverage? Well, we just had the annual enrollment period between October 15th to December 7th. If you are someone who has a Medicare Advantage plan card already, then we have what's called the Medicare Advantage open enrollment period, which runs from January 1st to March 31st. If you want to change companies, you have until the end of March to make one change. If you change during February, the change will be effective on March 1st. If you change during March, it'll be effective on April 1st. So if you've enrolled with a new company or something's changed with the company you already had and you want to try something else, now is an ideal time to do so. So and the other thing you can actually do as well, if you have an Advantage plan, is if you want to go back to original Medicare, you can do that during this period as well. You can go and buy a drug plan. So it is easy to switch from original Medicare. People ask me this, how easy can I go from original Medicare to a Medicare Advantage plan? You can do that every annual enrollment period, always October 15 through December 7, you can decide what you want to do for the following year. You can't be turned down for a Medicare Advantage plan that is on offer in your county. You can't get one from another county, but you can't be turned down for whatever's available here. That is new because it used to be that if you had renal failure, end-stage renal failure, you couldn't enroll, but now absolutely everybody can. Although the cost of a dialysis visit under Medicare Advantage is about $50 per visit. It's also easy to switch from Medicare Advantage to original Medicare with a drug plan. So again, you can do that in the fall. You can drop your Medicare Advantage and enroll in a drug plan instead, or you could do that at this time, as I said. But you have to remember that unless you have a guaranteed issue right for a Medigap plan, then you would be subject to medical underwriting if you thought, I'll switch from Medicare Advantage to original Medicare with a drug plan and a Medigap plan. So if you want to check if you would be in a situation to get a guaranteed issue right, you can have a look, like I said, on the web medicare.gov website, or you can just give me a call and I'll happily go through that with you.
Cathy, can I ask you a question that somebody
Yes.
has typed in? Well, there's a couple.
Mm-hmm.
The one I thought I'd ask you first. If you have credible insurance, can you get guaranteed issue Medigap insurance when you move over to Medicare, even if 70?
So that would depend. There's a couple of situations we would need to double check. First thing is, if you didn't already have Part B of Medicare, then absolutely, because it'd be based on your new enrollment in Part B of Medicare. If you have employer coverage, it relates to whether that coverage is primary or secondary. And if the person who's in that situation wants to give me a call, I will double check the exact wording of it, just because we've had that recently. I believe if it's coverage that pays after Medicare pays and that coverage is ending, then you have a guaranteed issue right. I think possibly in New Jersey, I only because this came up the other day, so I do have a message about that. If you have an employee benefit WellCare plan and that's primary to Medicare and you're in New Jersey, then yes, you would also get a guaranteed issue right. So yes, to that individual you should be, but if you want to give me a call, I can definitely talk it through as well.
Okay, and I will put Cathy's phone number and email address in the chat. Do you want me to ask you the other two questions right now?
Sure.
Okay.
Yep.
If I am receiving Survivor Social Security now, I'm turning 65 June 4th, 2021, do I automatically get enrolled in Medicare A and B?
Yes, and your coverage will begin on June 1st, and you will receive a card. I would anticipate you would receive it by March. So if you haven't got it during March, then you could contact Social Security to just find out. But usually when you're auto-enrolled, it comes out in really good time. So I would expect you to be getting a card pretty soon.
Okay, and then what is the best way to compare your Medicare supplement plan each year to ensure you have best rate for the best coverage? I have had same plan for 10 years.
So actually, with the Medigap plans, I do have access to a brokerage quoting tool, and I have done this for people, had a look to see what the costs would be, and with the Medigaps, being loyal to your plan does work usually in your favor. So what I found is when we looked, if you were to, so say the person you're talking about is 75, when we've had a look at what the cost of the same plan would be for someone buying new at 75, it is usually more than what the person is currently paying. So you don't have to check it, but if you want me to have a look at the tool, I can certainly do so. But because you'd be subject to medical underwriting, you may find that the premiums I get are the preferred rates. So you may find that it's more. But as I say, you can probably feel reassured that you're getting a better deal than someone who's enrolling fresh at the same age as you.
I have a question about that. So this is a Medicare supplement plan is what the
Yes.
question is. Is that Medicare Advantage or
So that's a Medigap plan. So the Medigap plans have two names. They're either known as a Medigap or a Medicare supplemental plan.
Oh.
The reason why we tend to say Medigap is because supplemental plan could cover a retiree plan as well. So it's just to be absolutely clear that a Medigap is the one you're buying, and as this person is saying, researching themselves.
Okay. All right. Thank you.
No problem.
All right. Back to
Okay. I'll carry. If there's any more questions, do feel free to stop.
All right. Thank you.
So the Part D prescription drug plans, they are offered by insurance companies contracted by Medicare. As part of that contract, they have to offer at least 2 prescription drugs in each treatment class. They have to cover insulin and supplies for injecting insulin, not the test strips. They actually come under Part B for boy of Medicare. And the insulins covered may vary. So you do have to be sure that you check for the actual insulin that you need to take. They do cover most vaccines, both the cost of the drug and the fee to administer. For example, the shingles vaccine. And I can say that that was coming in at around $200 odd in the fall when we were checking. But if there was quite a lot of confusion over how that was actually going to play out in the pharmacies, just because it was a tier 3 medication for a lot of people. Instead of having the normal tier 3 copay, it was coming in as a higher copay, and that may have been because of the fee to administer. Now, people are probably thinking about the COVID-19 vaccine, and I have got a slide that just specifically says this, but I'll say it now. The COVID-19 vaccine is actually going to be covered under Part B for boy of Medicare. It's covered under Part B of Medicare regardless of what other coverage you have. So that is the one time where if you have a Medicare Advantage plan, you would need to take your Medicare card. It will be covered in full. There is no copay for the COVID-19 vaccine. But most vaccines come under Part D for drugs. The flu vaccine is another one that comes under Part B of Medicare. Now, if a drug isn't on formulary, you would have to pay the full cost of the medication. So you do want to make sure that your drug is on formulary, and the formulary drugs are given tiers, and the tiers affect how much you pay. So tiers 1 and 2 are generally generic medications. Tiers 3 and 4 are brand name medications. So I just mentioned Shingrix being a tier 3. And tier 5 are the specialty medications. They're generally the ones you'll see advertised on television and are the highest cost. Tier 6 are actually, not all companies offer tier 6. Where they do, the tier 6 medications are clinically effective and they're offered at a low cost price, but not all plans have that. So when you're looking at your Part D prescription drug plans, this year in New Jersey, there are 30 drug plans available. There were 28 last year. The premiums range from $7.30 to $97.70 per month. Just because you're paying a higher premium doesn't necessarily mean you're getting a better plan. You do want to make sure that the plan you're getting meets your needs. I had a look at somebody just the other day, and they were, if they stayed where they were, then they would be paying over $1,000 more for a more expensive plan because it didn't actually cover one of their medications, even though the two plans were offered by the same company. Now, the median premium in New Jersey is $34. But as I say, the range can be wide. Now, in 2021, the maximum drug deductible is $445. It is up to the companies if they decide that they want to apply that deductible at all tiers, or if they're going to apply it at all. And usually, if you're paying a higher premium, then the deductible will be lower or not there, but it doesn't always follow. Now, during the deductible period, you pay the full cost of the medication until you reach that deductible limit. So for some people, it may take several months, or they may never reach the deductible. For other people, they are through that deductible, and in fact, may get through all the different coverage periods before the second month that they're on a plan. Now, the initial coverage period, you pay a percentage of the drug cost defined by your insurance until both you and the insurance have paid $4,130. It's actually not that hard to get to that figure. That's because if there's a medication that you are paying a $40 copay for that costs $1,200 if you're paying it in cash, the amount that the drug plan is paying actually, or the insurance is paying, actually gets you up there very quickly. You then enter the coverage gap, or used to be known as the donut hole. During that period, it used to be you would pay the full cost of your medications. You basically had to spend your way out of it. Now, during the coverage gap, since the Affordable Care Act, the coverage gap has been closed so that it goes down to you only pay 25% of the cost of your medications until, again, you and the insurance have paid $6,550. Some people find that they're actually paying less in the coverage gap than they were initially. Other people don't. It just depends on how much you were paying. If you had a medication you were paying 40% of the cost for, then when you go into the coverage gap and you're only paying 25% of the cost, you will be paying less. Once you've got out of the coverage gap, you go into catastrophic benefit, which point, you pay either 5% of the cost of your medication or kind of up to $8.35, depending on the medication, and the rest is covered by insurance. If it's an expensive medication, 5% is still a lot of money, I know.
Kathy, sorry,
yeah.
Kathy, a question about Part D. Does Part D cover injecting drug for RA?
So it's going to depend on how that medication is prescribed. If it is ordered by the doctor and injected in the office, you may be able to bill it through Part B. If you are ordering that medication, it comes from the pharmacy and you self-administer, it's probably going to be through Part D. That is, I'd say it's like the Prolia injection. It's one where sometimes losing some of the independence is financially better value if you can then get it done at the doctor's office, particularly if you have a Medigap plan that covers your Part B copays, then you would find that you're not paying for it. Whereas if you're getting it if you're getting it through the drug plan, it may not. So if that person wants me to have a look, I can see what the costs would be. Also, if it's a medication like that, the manufacturers are usually really good. They want people to take their medication. They can probably give you some advice as well about how the best way to get it billed. Or again, if because it's a specific condition, there may be some like RA Facebook groups, or I don't know if there's an RA society here, but whatever charity might be specific to it can probably give you the best information about it, if that makes sense. Any other questions about Part D?
That's it right now.
Okay, so I've said there are 30 plans available. It is a wide choice. The lowest premium plan is called SilverScript Smart RX. It's only $7.30 a month. If you remember, I said that if you delay enrollment, you could be paying a $4 per month penalty for every month for the rest of the time you're on Medicare. Then buying a plan at $7.30 makes sense. Now, it does cover medications. So if you have to go onto something urgently, you do have a plan. I would say, though, that with that plan, you do need to use it at CVS or one of the other preferred pharmacies. It doesn't work at Walgreens. So if you're not going to go to a preferred pharmacy, then it may not be, even as a backup, it's not a great idea. But there are 4 other plans with monthly premiums under $17 a month. So you don't have to spend a lot on your drug coverage. Now, more than half of the plans, 17, have a $0 deductible for at least some of the tiers. Generally, that's because you'll see no deductible for, say, tiers 1 and 2, or for tier 1 medications, which is great news if you only take generic medications, because you're not having to meet that $430 deductible before the insurance kicks in. There are 4 plans that have extra coverage in the coverage gap, but that's really specific. It just means that for specific or certain medications, you pay less than the 25% cost. But unless the medications you take are one of those specific drugs, then you're not really getting any extra benefit. So when we search for a plan, that will all be taken into account. And just as a note, all the SilverScript plans are actually owned by Aetna now, but they kept the SilverScript name. So if you really like Aetna, then SilverScript is your company. Now, new for 2021 is something called the Senior Savings Model. It was designed to help reduce the costs that people pay on their insulin. However, not every company offers it. And although it does make the insulin costs more predictable, for some people, when you look at the plans, the Senior Savings Model plans, even for people who take insulin, don't necessarily work out as the best value if you take other medications as well. All of this is calculated, though, through the Plan Finder tool, which is what a SHIP counselor would use to find the most cost-effective Part D drug plan, because it's going to look what is best for your medications, how often you take them at the pharmacy that you use, and for how many months of the year you've got left. So if you're new to Medicare in June, then we only want to know what the costs are for you from June onwards. You don't want to know a full year cost. Now, the Plan Finder tool, you do need to go to medicare.gov, G-O-V, rather than .com, C-O-M for commercial, because the government tool is not going to sell you something, it's just going to churn out the facts for you. It will also tell you if there are coverage restrictions, so it'll tell you if there are quantity limits, if you might need prior authorization from your doctor, and also the one to watch for is step therapy, which is where you would be required to try other medication prior to getting the medication that you want, which for some people really may not be good at all. And regardless of when you enroll, you do need to review your plan choice every year during the annual enrollment period, October 15 through December 7th. It's definitely worth doing so because the plan offering can change quite considerably from year to year. And you may find that your plan is not the best value for you. Tara, did you have another question come in? I'm going to assume not. Oh.
No, I'm sorry. I don't have another question. I typed in your cell phone number.
Oh, okay. A little thing came up and I thought, oh gosh, yes. Is there something else? Right, yes. Apologies, everyone.
No problem.
So I've just talked about medications are expensive. There's no two ways around it. I know it's being discussed at a federal level, but until then, if you are living in New Jersey, there are some programs that help with prescription costs. They are for New Jersey residents only because they're funded through the casino monies, and they are two of the least well-known and well-taken up plans for people. So one is the PAAD program, or Pharmaceutical Assistance to the Aged and Disabled program. Now, the state of New Jersey will enroll you in a Part D plan, pay the premium, and pay any late enrollment penalty. So this is great for people who just didn't enroll because it seemed too expensive. And it also limits what you have to pay at the pharmacy counter. The income limits, it's only income limits. It's only if you are earning from your savings taken into account, but otherwise as an asset, they're not. And the limit is quite generous if you're single, not so generous if you're married. It's $2,367 per month if you're single, but only $2,900 per month jointly if you're married. The Senior Gold Prescription Discount Program is there if you earn a little bit more. It's basically an extra $10,000 per year both for single and married. It wraps around your Part D coverage, so it doesn't pay any premiums, but it will help with medications, and it helps through all parts of the all the different coverage periods. Now, you can apply for these programs through NJ Save, which is an online it's an online application. It is a paper one. I would say to you, try not to do a paper application at the moment. Governor Murphy was already prioritizing online applications before the pandemic, and now you have to wait. If you do a paper one, you've got to wait for it to be received at the mailroom, to be scanned, and then get processed. You can either apply online yourself, or I am more than happy to do this over the phone with you. It does not take long. Usually I say 45 minutes, we'll get that application done and away, and we can often get a result within a week. So it's definitely worth doing if you think you're eligible. That program, that application will screen for the programs that help with prescription costs, and it will also apply for the Part B premium costs program, Part B premium savings programs as well, and also screens for help with your heating bills as well. So it's a really good application. I'd say it's not too difficult to complete. During the pandemic, we are getting more through without having to send in all your paperwork. So it's definitely worth doing. Like I say, I'm very happy to help with that. The Medicare Advantage plans, these are, again, offered by insurance companies contracted by Medicare. They're going to be structured as either an HMO or a PPO plan. If it's an HMO, that means you have to stay in network. If it's a PPO, you can go out of network, but the provider must agree to see you as an out-of-network person. And the reason that's important is because you have to get all your medical services and drugs through the plan. You can't chop and change and get some things from original Medicare and some things from Medicare Advantage. It's one or the other. So you need to be aware that what the network is. You may need a pre-approval for things or referrals, which you don't under original Medicare. The co-pays for the services will vary widely between the plans, so you do need to have a look at that. And just remember, all those claims are going to be processed by the plan, not Medicare. Says there, don't carry your Medicare card. Again, do if you're going for your COVID-19 vaccine, because you need it then. But on the flip side, the companies can offer additional benefits not available through original Medicare. So they can offer vision, dental and hearing coverage and gym membership. And after 2019, they've been able to offer a lot of other things. Now, when you watch the TV and you see the adverts, you're going to see loads of stuff talking about home delivered meals, expanded dental coverage, dollars for over-the-counter items, transportation to medical appointments, and so on. But I would say be aware when you're looking at that as to what that looks like. So the home delivered meals is not Meals on Wheels. It's a packaged, you usually get a set number of days, 7 or 14, all packaged at once that can go in your freezer after one hospital stay. So it's not even just when you need it. So need to be aware that these are extras that are being added in. So I wouldn't make my sole decision on that. So the Advantage plans available in New Jersey, the premiums range from as little as $0 per month up to $104 per month. This is in Mercer County. There is a bit more variation across the state, but here in Mercer between $0 and $104. So you have to pay that in addition to your Part B premium. But if you have either PAAD or the Federal Extra Help Program, you can get a discount of up to $35.50 on your Advantage plan premiums. And you can have your medication costs capped at the pharmacy counter. So I said to you, the co-pays for primary range from $0, actually it's up to $35, and specialist from $5 to $50. But check the cost of those other items. So I taught you like an ambulance trip's $250, not those daily inpatient co-pays being $300 to $400 per day for the first 5 or 6 days. Each of these has a cost associated with it. Lab tests may be $0 at an in-network facility, but you might be paying $20 or $30 a visit to go to a physical therapist. And if you're going there 3 days a week, it does start to add up. So it's kind of a pay-as-you-go system. So you're paying a lot less on a monthly basis, but on the flip side, if you need services, you will be paying. And as I said, the out-of-pocket on medical is capped. Now, there are Advantage plans on offer that don't have drug coverage. They are generally aimed at military veterans who have drug coverage through the VA. Because the VA benefits are considered creditable drug coverage, you don't also have to get a prescription drug plan. But you do want to be aware that if you're only have VA coverage, you have to get your prescriptions at a VA pharmacy or facility, filled at a VA pharmacy or facility. So, if you were somebody who's not a veteran and you thought, I'll have an Advantage plan without drug coverage and a separate prescription drug plan, that's not going to work. And if you don't have creditable drug coverage, so you get an Advantage plan without drug coverage because it looks better value, then you'd be subject to that late enrollment penalty at a later date when you did want to get a prescription plan. When you look at your card, there's a few things to look out for. If it's got the Medicare RX on the card, you know you've got prescription drug coverage. You should be able to see if the plan is a PPO or an HMO. And remember that you're only going to see top line co-pays on the card to make sure you know the cost of other services. And if it's an HMO, just check if you need referrals. So in Mercer County, we've got 34 different plans. 4 have no drug coverage. 18 plans are HMO plans, so the others are PPOs. So there's definitely a move towards more PPOs and more flexibility. All of the plans have vision, dental, and hearing coverage. That's pretty much standard these days. And there are actually 14 of the Medicare Advantage plans with drug coverage have $0 premium, and 2 of them are going to pay you to enroll because they will give you a discount if you pay your Part B premiums of $50 to $60. So you can actually make money out of this if you're healthy and well, but you've just got to kind of predict that into the future. Now, providers can leave a Medicare Advantage plans network at any point in the year. You cannot. You have fixed times when you can change. The plan themselves can only change their services and costs annually. So In the fall, you want to check your mail for any updated information. For example, Horizon were offering a plan that was a $0 premium in 2020. It's now $31 per month in 2021, and that has caught some people out. But the good news is for those people is if you're already enrolled in a Medicare Advantage plan, you can make a change during this period. So as I said, January 1st to March 31st. So how do you find the plan that's right for you? Well, it's a plan finder again. The reason being because you want to check the cost of your medications, bearing in mind that you have to get them through that plan. So you do the same thing to work out what the premium and medication costs will be. Then you can look at we have a really handy chart that tells you what the cost of everything else is and what the extra benefits are. And I can easily email or mail that out to anyone. You also do need to check that your doctors are in network. So it's up to you which way round you want to do it. If you take a lot of medications, I'd start with that. If your doctors are the most important thing for you, you could check with your doctors first who are in network. If it's a PPO plan, you just want to check that your doctors will accept the plan that you want. It's not just doctors, it's also hospitals. So again, you want to make sure is the hospital that you like to go to in network with a plan or accepting it. With those extra benefits, like I said, just remember they may be more limited in scope than you would like them to be. So make sure you're happy with the medical and the drug coverage before you sign up. Don't just base it on the dental coverage, for example, as you could get dental coverage elsewhere, but you're not going to be able to get your doctors elsewhere. So this is what I wanted to say about the COVID coverage. So Medicare is covering the COVID-19 related needs. Actually, the Medicare Advantage plans are very good in 2020. They waived some of the co-pays for COVID admissions. Unfortunately, original Medicare cannot do that, but they would cover the hospitalization in the same way as they normally would, because it's a necessary hospitalization. Telehealth has become more popular, and Medicare is covering more of those virtual check-ins so that people didn't have to go out and about. And the COVID-19 antibody treatment was being covered in full, is covered in full as well. And then the big thing is the vaccine. So just don't forget to take your take your Medicare card so that it can be billed to Part B. Now, just as final reminders, if you have original Medicare, make sure you take advantage of your free and reduced cost Part B preventive benefits. These are things like a flu shot, an annual wellness visit. There are lots of screenings. You can see your Medicare and You handbook, or you can go to medicare.gov for a full list. It will tell you not only what the screenings are, but how often you can have them, and they'll be covered. Beware of scams. Don't give anyone your Medicare number. It might not be your Social Security number anymore, but it is still your health number, so keep an eye on it. And don't give anyone your bank details in exchange for either a COVID-19 test or vaccine. There are some unscrupulous people who are trying to take advantage. And then I always want to remind people about the enrollment period every year. I know we've just gone past it, but it's a really hard finish on December 7th at midnight. Medicare is not very understanding if something got in the way of you enrolling. So definitely make sure you do your reviews in good time, but we are here year round to help. So SHIP is here all year, a little bit busier in the fall, so it can be harder to get hold of me, but the rest of the year I'm here and ready to help. So please do get in touch. As I said, you can call, you can text, you can email. You can reach out on Facebook. It'll still be me. Whatever way you choose, you're going to get me at the end of it. So if you don't like me, I'm afraid you're right out of luck. But you can tell me that and I'll get you someone better. But we can go through the programs to help with the costs, reviewing your choices and going through the costs, reviewing your coverage. And just basically, as long as it's Medicare, I'll do my best to answer it. I'm not very good at non-Medicare questions. And that is it, unless there's anything else that anyone has asked or any questions that anyone has.
Let's see, does anyone have any questions they'd like to ask Cathy? I think you've answered all the questions in the chat, and there's your information. I was going to ask for that, so we have that, and I guess no open questions. That is overwhelming, Cathy. And you talk really fast with no water break there. Thank you very much.
So I should just say, so the reason I appreciate everyone giving up their time and listening. It is a lot of information. When you speak to one of our counsellors are volunteers. Most of them have been through this themselves. They will speak slower. I do speak slower usually, but probably not a lot slower. But it's really to try and give a very much an overview, just partly to say, please do get in touch and we'll go through it in more detail. But yes, I usually try and get people with one of our SHIP counsellors, so you can go through it and get more info.
The question just came in.
Yeah.
Is there any, let's get it back. Is there any vision or dental coverage for Part B?
No. So when Medicare was set up, it's only medically necessary items. So cataract surgery is covered under Part B of Medicare. And I assume if you got like a dart in your eye or something like that, that would be covered again under Part B of Medicare. But your general vision, no. And I don't really understand why, because as people get older, vision and hearing are two of the things people struggle with the most. Mm-hmm. The Advantage plans obviously do offer some, and that is an advantage of those. But otherwise, your general vision and the glasses that come with it wouldn't be covered. If you do have cataract surgery, though, and it's covered, so you have cataract surgery, and as a result, you need a new pair of glasses. If you get your glasses from a provider that is contracted with Medicare, you can get a rebate for some of the cost. I think they don't really cover the new frames, but they will cover the lenses, but it has to be a provider that's already registered with Medicare to be able to do so.
I have another question that I have no idea what this means. I hope you do. What is the difference between parts G and F?
So those are your Medigap plans. So the plan F is one of the plans that has been grandfathered. The only difference between Plan F and Plan G is that Plan F pays the Part B deductible, the Part B for boy deductible. Now, if you remember, I said that in 2021, the Part B deductible is $203. I did look at this recently for somebody, compared the cost if they were to go with Plan F versus Plan G, because it was someone who was eligible. And we found that over the year, the Plan F was going to cost about $260 more than the Plan G. So you would be paying more in premiums than you'd be paying in your Part B deductible. But that is the only difference.
Okay, thank you. And let's see.
One more from your audience.
Can we email you to get the details about what you are talking about today? Oh, yes, I can send the PowerPoint to the
and you can contact me directly. So if anyone needs anything, you can contact me directly, or you can contact the library. Either one.
All right. And one other question: why is there not a Part E?
There's A, B, C, D.
That's from my. Not yet. Is that what you just said, Cathy?
Well, yes. So if you think Part D didn't come until 2006, and Part C, I think, was in the I looked this up and I've forgotten now. I want to say it was the 1980s for Part C. Maybe in another 10 years or so time we'll have a Part E. Maybe that would be vision and dental. Vision and hearing. I don't know. It's very confusing.
I know, because I never heard of Part F and G. So
they're plans. So
they're plans.
Plans F and
oh,
G.
Right. They're plans.
So the plans are between A and N, and you actually do have A, C, D, F, G, J, K, L, M, N. I think. No, J is gone. J has been retired. Some have been retired.
All right. So they're plans, and that's a part. Oh,
yes.
Oh my gosh.
Why they chose the same, I don't know.
Okay.
Except that obviously we all like letters.
Okay. My goodness. All right. I get that now. So I think
but it's a very good question, because it makes you worry you're missing something out.
Right. Okay. True. So I think that's all for now. Thank you so much for all this information. And I will email everyone your PowerPoint.
And if anyone needs anything else, do email or call or text. And I say to everyone, if I don't answer, please do leave a message. I call everybody back.
Okay. All right. Thank you, Cathy. And I think I have a few people here still. I'll tell you that we have another program tomorrow night at the library by Zoom. It's Augusta Savage, Renaissance Woman. It's an art talk by an art educator. We've been doing these monthly art programs, and this one is about Augusta Savage. She was a celebrated sculptor, African-American sculptor, and her work as an arts educator and political activist catalyzed social change. This talk will explore Savage's lasting legacy by examining her remarkable life and affecting works, as well as those of the younger artists she inspired. Very, very interesting story about this artist. So that's tomorrow night at 7. So thank you everyone for coming tonight. I hope this was helpful. I know it was very informative. Thank you, Cathy.
You're welcome. Thank you.
Appreciate you doing this for us.
You're very
good night.
welcome.
Good night, Cathy.
Good night.
Good night, everyone. Thank you.